Hi everyone, welcome to today's webinar. My name's Courtney and today's just going to be a short 15-minute run through on our new video conferencing enhancements in HotHealth, and I'll also do a little walkthrough of the new features as well. So last week we released a pretty major upgrade to our video conferencing tool in HotHealth. We've now streamlined the process for having a video consult, and also we've added some new features in that weren't there before. So today I'm going to go over how you can use HotHealth for telehealth purposes, what the new features are, and finally I'll do a walkthrough of the booking and having the video consult as well. So I think everyone here at the moment knows about global health. So you'll know that we've been around for about 35 years. We work with Australian healthcare organisations and bodies to ensure that our products are meeting the requirements of health businesses in Australia. Since COVID, we've had to make a lot of improvements really quickly across our product range in order to support remote healthcare across the industry. So some of those changes and upgrades that got brought forward in the timeline are HotHealth forms, these new video conferencing features that I'm about to go through, and also things like e-prescribing, which are relevant for some of our other products. So we want to make sure that we can offer our customers tools to enhance their care for their patients. And HotHealth, for one, is essentially your doorway to offering digital healthcare services. It's locally hosted in Australia, and there's encryption tools around transit and storage of data. So today I'm going to be focused on where HotHealth fits in for providing remote consultations and telehealth. If you've got any questions that would be specific to everyone, or general to everyone I should say, feel free to type them in the chat box. If you have questions that are specific to your organisation and how you can use HotHealth, feel free to drop me a line after this webinar and we can chat through that together. So, telehealth. So this stat here that 50% of people will leave their healthcare provider for one with better technology, that was actually a stat from before COVID. So I would be interested to see that number now of what people are going to for healthcare services and what businesses they're willing to spend their money with and get their care off. So why HotHealth for telehealth? There's a few reasons. So one, it's branded to your branding, keeping a consistent presence across your online touchpoints with your customer. It's device agnostic, so you can use it on any device through the web browser. And with the use of the web browser as well, it means it can be integrated with some of your other processes and programs in your services. So there's no other apps needed. Those that were using HotHealth a few weeks ago or a month ago, you would know that you used to have to download another app, Skype for Business, to actually have the teleconsult. That is no longer the case. So it's a much more streamlined process for all parties involved. You just click on the join meeting button and away you go. It just opens up in your web browser. This is also really good if you're running other programs at the same time. So things like web-based practice management systems or clinical records. It essentially allows you to do all these things in the one platform. It's Australian hosted in Australia, so that it adheres to all those guidelines that you hear about for teleconsultations by Australian healthcare organisations. We are based in Melbourne, so you have a local support team. I'm actually based in Queensland, so we're kind of all over Australia, but we're local, and we want to be able to help other Australian businesses deliver their services. HotHealth's also scalable, so you can see at the top all the different things you can do with HotHealth. You can just start with video conferencing, but as your needs grow and your organisation evolves to be more digital, you can enable things like online bookings, digital forms, which can be used across a really wide array of use cases, anything from registration all the way through to patient satisfaction. And then finally, we've also got the integration with Lifecard, our digital health record app, which really leaves the door open for you to provide additional services around remote care and monitoring. So the video features in HotHealth, these top ones haven't changed. So patients can book in if you want them to be able to. We have staff bookings. So if you don't want the patient to be able to book in for teleconsults, you can just enable it for staff bookings only. There's email invitations that go out to the patients. Then there's automatic reminders through email as well to remind them that there is an upcoming appointment. There's iCal integration, so they have the chance to save that invite to their calendar. In HotHealth, once they're logged in, you can see upcoming and past appointments, and then the chat function is still there. From a new features perspective, we've enhanced, as I said, the workflow for video consultations. It's a lot more smooth, all within that one web browser. We've also now got group bookings and appointments. So as a staff member, you can invite multiple participants to the meeting. This might be one provider, numerous patients. It might be one patient, a GP and a specialist, or an allied health provider. So that care team. It might also just be 3 healthcare providers that need to jump on a secure call to have a discussion about a patient's care. We've also got screen sharing now, so you can share your screen from a desktop or laptop device, and then just some other small features as well. At the moment, we're working on some new features such as a whiteboard capability, so that shouldn't be too far away either. So you know that deal with your patients and other providers on the call. There's also will be the ability to be able to save the chat manuscript or transcript to your clinical system via ReferralNet. So that's anything that's typed into the chat box while you're having the call. So before I jump in to show you the actual platform and how you'd have the call, I'm going to be going through this workflow. So the staff member books the appointment. So I'll be able to show you where you can have the other participants invited. The attendees receive automatic confirmation and reminders, and then the online appointment occurs. So I'm just going to jump into HotHealth now. So you can see here that email reminders are sent out, and you can actually just click on this button to go directly to the appointment details page. So this is the appointments dashboard in HotHealth. To make the booking, a staff member would click on staff booking. We would select that it's a teleconsult session, and you'd select the staff member that session is for. Select your start time and end time. Pharmacist B has a default setting of 5-minute times, but you can extend that to however long you need as a staff member. As a patient, if you were booking in, you would just book in for the default time set. Once you've put in one participant, you can then add other ones that you need to invite, and you can just copy and paste those details from whatever other system you're using to manage your clients. And you can actually add up to 50. It can hit 49 participants, so 50 total, including yourself. Once you click create, a trigger will be sent, and the participants will receive appointment notifications, and as the time gets closer, they'll also receive reminders. So I can see here I've got one coming up. I'm the provider. I can see I've got one at 12:35 for Laura. I'm going to click on that appointment. And on here, the patient would also see this screen from the link they've clicked on in their email. Alternatively, they can also go to their appointments page and see their own upcoming appointments. To join the teleconsultation, which I'll do in a minute, you click on this green button. There might be some slight lag with the video because I'm got 2 videos going. So if I'm a bit pixelated on this screen, that's why. So it'll prompt you to allow microphone and camera use. And we can see here, this is Laura, our lovely Laura, who you sometimes will have a phone conversation with in Global Health. This is what the screen looks like from the provider and also the patient's perspective. So yourself, you'll be on the left and they'll also be on their left, and then anyone additional will be on the right-hand side of the screen. So down here, we've got the chat where we can chat into. You can also send files through that as well. So if you wanted to send a PDF or an image, if the patient has been tracking some, I don't know, wound healing or something else, or if you've got, we've also heard of the situation where a child might draw a picture. If it's a mental health session, you can send that through there. We've also got the screen sharing feature. So on here, I can click share screen and it will prompt me to share one of the screens in my computer. I'm not going to do that now because we'll get really bad feedback between the webinar and HotHealth, but you just select your screen and this icon here on the left will appear to show that you're sharing your screen. So that's the screen sharing. You can toggle on and off your video. And you can also toggle on and off your microphone as well. So to end the call, we just click leave consultation and the call will end. So if I go back to here, once the call's ended, the appointment stays open while someone is in the appointment. So if you are late to the appointment, you can still join it if the room is active. If you drop out for some reason because your internet lags or you need to log off to take a phone call and jump back in, you can still join in an appointment even if it's past the scheduled end date, as long as the room is still active. Soon you'll also have the capability to save the chat conversation after the call. HotHealth itself does not record the video itself, so that is all not saved anywhere from our perspective. In terms of group numbers, as I said before, you can invite up to 50, and in those large call instances, anywhere from 5 people onwards, it will be in dominant speaker mode, where the dominant speaker is the large part of the screen and everyone else is just in boxes along the bottom. If it's a small group meeting, so smaller than 4, if you're on a laptop or desktop, each member will appear as like a quarter of the screen. And if you're on a phone, it reverts back to that dominant speaker mode because the screen size is smaller. On a phone, you can see a shared screen, but you can't share a phone screen. So if a provider was sharing a screen from their computer, they would be able to view that. So that's the walkthrough. So since COVID, we've heard a few stats around telehealth, and one of them is that telehealth usage has risen something like from 2% across an industry to more than 40%, and in some instances around the world, that number is even higher. And other industry trends and bodies are kind of saying that's not going to go away anytime soon. Now that people are used to using technology to have consults like this, it's something that we're going to just have to incorporate into our workflows. I think it was also always on the roadmap for people to jump on board the telehealth train, but this COVID-19 pandemic has just brought forward all those timelines. So from a pricing perspective, HotHealth is a subscription monthly based model. So you just pay like a $60 a month subscription, and then features such as video consults are a usage fee. So you just pay as you use. You can view all of our pricing on our website, and for some of our global health clients, if you're using Mastercare Plus, you also get a 25% discount off your monthly HotHealth subscription. So that's HotHealth. If you did have any questions, please feel free to email me or email us at hothealth@global-health.com. All the information is on our website, and as I said, I will be uploading this webinar to the webinars page on our website. So if you want to go back and watch any of it, you can, or if you need to share it with some other team members, you can do that too. Thanks for your time. That's our little 15-minute webinar. We're going to try and do more of these over the next few months. Our next one will probably be on digital forms. So if you're interested, keep an eye out for communication about that. And if there's something that you do want us to focus on, please let us know. We are all ears. Thanks, guys. Have a great day. And I'll talk to you next time.